Hi everyone, I'm Dr. Faisel Syed,
And I'm Dr. Dan McCarter.
and you're listening to Faisel Friends, where we believe access to primary care is a right, not a privilege.
Today we're talking to Dr. Tim Hoff from Northeastern University about searching for the family doctor. Let's dive right in.
Hey Dr. Dan, hello Dr. Hoff, nice to meet you.
Hi, nice to meet you both.
Yeah, we're so glad to have you on. For our audience, Dr. Hoff is a professor of management, and he's the author for the book Searching for the Family Doctor, Primary Care on the Brink. So thank you so much for joining us today.
Sure, thanks for having me.
Well, Dr. Hoff, outside of people like, someone like Larry Bauer, we rarely come across people as passionate about family medicine outside of family medicine doctors. And you're definitely in that category with all these books you've written, all these articles.
Yeah.
I've really been looking forward to meeting you and talking with you about business and medicine. You can imagine, our doctors, we practice in the full risk model. So, they have to know about business and they work closely with business leaders and all. But I wanted to know about your story. I mean, what was it? I mean, that drew you to family medicine, and then something happened in Albany. What happened there that turned you into this, this beacon of hope for the future of restoring the sacred doctor-patient relationship?
Well, it's nice to be called a beacon of hope. I've been called other things, and so that's nice to hear. I was a young business school graduate back in the late '80s, right around the time of managed care. That wonderful period of healthcare we all remember. I sort of fell into a job at a Department of Family Practice at Albany Medical College as an assistant administrator. Knew nothing about healthcare. Started working with helping to run the practice. We had a big residency program. I actually started teaching young family medicine residents about billing, which was amazing in my early 20s, teaching these really smart family doctors how to think about coding and ICD, whatever it was at the time, ICD 5 or 6. And so I sort of fell in love with healthcare, and then I did some consulting after that. I went into healthcare consulting and continue to sort of work with primary care and process improvement in the primary care space. And I just think it's the most important part of medicine. And so when I became an academic and I went into doing research full scale, it was natural for me to kind of want to study what was going on in primary care. I already had my own research questions from working in primary care that I'd come up with, in my own head, having worked in the space. And I've done other research over the years, but it's sort of like I keep coming back to sort of studying primary care. And obviously over the last decade, really getting interested, because I also study innovation, really getting interested in the tipping point that part of the system has reached in terms of potentially transforming, particularly in the US, into, something different in 10 or 20 years.
You think it'll be that long to change away from this hospital-based healthcare delivery system?
It's hard. As I teach my students, the future is coming, but we just don't know what future and when.
Yeah.
It's like I've given up making predictions in healthcare for the most part. Although in my book I had to make predictions. The publisher said you have to make some predictions, so I did. I think there's some things that are coming a lot quicker than others at this point. And as we know, the pandemic has sped some of that on.
Yeah.
Some of it involves technology. Some of it involves how primary care is going to look in a few years in terms of versus how it looks now or how it's looked in the past.
So I was speaking to a group of residents at an academic medical center today, and they were, I'm not going to call it by name, they were feeling sort of beaten down by the way they're being treated at the academic medical center. But I was telling them, look, Amazon just bought One Medical, and in the news today, CVS had bought Signify Health, and I know it hadn't been too long since Walmart was in the news about starting some of their super health centers, and they're all going towards primary care, and these are all corporations. If they wanted to buy hospitals, they could be buying hospitals. What is your thought about why the business people are going after primary care in today's world?
Profit. And in some, I mean, I think, and I wrote about this a lot in my 2017 book, Next in Line, which was really about sort of the consumerization movement and this whole notion of bringing in retail thinking into healthcare and primary care. I think, obviously big tech companies and big corporations like CVS, right? They see a lot of low hanging fruit in the business right now. They look at healthcare and they say, and primary care, and they say, holy cow, like these guys haven't figured out a way to do this better yet. They haven't figured out a way to do it more cheaply and still preserve some quality and give consumers more choice and let them get real time access. What they're finding out is it's not as easy as they think it is, right? So Amazon's come into healthcare. They've gone out of healthcare. They had their little shops open and they closed them. Everybody's scrambling to sort of gain some space. And the most recent, thing that I think the industry is looking at and sort of, with dreamy eyes is this whole notion of moving care into the home and being able to move, aspects of primary care into the home through technology and also using, they say they want to use physicians, but I'm skeptical about that.
Yeah, I mean, that's part of the issue, right? One of my good friends just switched jobs, and it's really hard for him to accept, the business side of healthcare. We get into conversations about how can we reduce all the unnecessary hospitalizations and all that stuff. And he said, Faisel, listen, all I looked for was how much is the salary, how many patients I got to see every day. I don't want to get involved with the business side. And he's a family doctor too, this is a family doctor. And we've gotten to the point right now where the primary care doctors are saying, well, let somebody else handle it. Do you see another way around that?
Well, I mean, you hit on a really good point. I mean, in some ways, it's promoting a death spiral for family medicine. I mean, this is what I talk about in my book, right? Everybody wants work-life balance now, not just doctors. Everybody, wants career sustainability, right? We're working in industries that are moving fast, changing quick. The pandemic has worn us all out. Primary care doctors have had, terrible afflictions with burnout and things like that. However, and I make this case in the book, the answer for the field as a whole is not to have a lot of family doctors sort of turn off and say, well, I'm not going to get involved in the business of medicine. I'm not going to open my own practice. I'm not going to sort of engage more than just being a 9-to-5 employee, because if they do that, they're sort of giving themselves over in one way to the corporation. I mean, and to the control of that corporation. And if you ask any doctor, I don't care. I've been studying doctors forever and I know tons of doctors and I'm friends with them. It's still about autonomy. I mean, it's still about control. As an elite professional, you want to feel some control in your work. And if you just say, well, I don't want to deal with the business side and I don't want to deal with the hassles and I'm happy for the hospital to take it over, you lose control. And over time, I think, especially younger doctors, they realize that, which is why I think so many get dissatisfied or potentially burned out.
We need to change the phrases then. Instead of being a full risk doctor, like you could be a full control doctor or a fully responsible doctor. We need to.
Yeah. The terminology definitely is important, right? And I don't think, when I was a younger academic, I studied autonomy a lot in doctors. I'm trained as a sociologist. So, and it's funny how we don't talk about autonomy as much anymore.
No. I mean, they've gotten so focused on these evidence-based medical guidelines that sort of like, all this, we got decades now of evidence-based communication strategies with how to be more of an influencer. That kind of, it's a side note.
Yeah, exactly. And I'm sympathetic to family doctors wanting more career stability, career sustainability. Again, I write about this in my book. I interviewed a lot of doctors in the book, who, young and old, who said, look, this job's too hard. If you want to do it in the fullest extent of the way possible, if you want to be a real comprehensive care doctor, this job's really hard. And so, you know, a lot of them want more stability, and they want to be able to get up every day with energy to be able to go in and do this really tough job. And so part of it, you know, they end up having to make some choices about what they can and can't do in the profession. And I don't blame them for that, because we're all built in that way. We need jobs that can leave us somewhat sustained. But the problem is there's so many now moving in that direction. It can affect the specialty as a whole.